Today, there's a growing outcry over the Trump administration's move to dramatically slash the childhood vaccine schedule. In a push led by HHS Secretary RFK Jr., the CDC now recommends just 11 routine vaccinations for all children, a significant drop from 17. That's been the standard for years. The new schedule means shots for things like rotavirus, hepatitis A and B, meningitis, and the seasonal flu are now more restricted. Joining me now, Dr. Paul Offit, director of the Children's Hospital of Philadelphia's Vaccine Education Center. He's also a former member of the FDA Vaccine Committee. It's good to see you again, Doctor. Bottom line, what does this new vaccine schedule mean for children and families?
I think what Robert F. Kennedy Jr. believes falsely is that children are getting too many vaccines too soon, and that that's somehow weakening or overwhelming or perturbing the immune system and putting them at risk for chronic diseases, which is false. And there's abundant evidence showing that's false. So that's what he's doing. He is a war against vaccines. And so now he's taking vaccines that have routinely protected us against diseases and made them essentially optional. It's the so-called shared clinical decision-making, meaning you can reasonably make a decision not to get these vaccines and put your child at risk. And what I fear is it's going to cause a continued erosion in vaccine rates, and we're going to continue to see the kind of outbreaks we're seeing now of measles and tetanus and whooping cough and flu, where flu has killed, almost 300 children last year. So all this in the midst of one of our worst flu seasons, Robert F. Kennedy Jr. has, through HHS, Health and Human Services, just stepped up and said, it's an option. You can get it if you want.
So beyond the flu, and if we can, let's put that list up again. Is there another vaccine that you're concerned about kids not getting? Again, that list: COVID-19, meningococcal disease, hepatitis A, hepatitis B. Is there something we should be particularly worried about besides the flu?
Just worried about all of them. But I think COVID is a perfect example. There was a committee or meeting by the CDC on April of 2025, when we still had a CDC, and Fiona Havers presented COVID data from the past year. What she found was that there were about 10,000 children admitted to the hospital with COVID. About 1 in 5 were admitted to the intensive care unit. 152 children died of COVID. Most were previously healthy. Many were less than 4 years of age, and none were vaccinated. And so they recommended the COVID vaccine. Now he's saying, well, you can get it if you want. And if you've never been naturally infected with COVID, or you've never been vaccinated with COVID, know that virus continues to circulate. So a choice not to get a COVID vaccine is a very real choice to get COVID, which can be serious.
So we can talk about choice, and there are people, kids on their parents' medical plans. That may be a choice that a parent and a doctor can make. But is there another practical impact this could have on availability for low-income Americans? Will the underserved be even more underserved?
Well, so the administration made it clear that shouldn't be true. In other words, that the vaccines would still be covered by the Vaccine for Children program, which does serve uninsured and underinsured children. But I don't trust this administration. I think their goal is to make vaccines less available, less affordable, and more feared, because Robert F. Kennedy Jr. is waging a war on vaccines, or said another way, waging a war against America's children.
Let me ask you really quickly, in 3 years, how difficult would it be to sort of restart what has been the way we've dealt with childhood vaccinations for decades?
Well, I think the first thing we would have to do is make sure that the Advisory Committee for Immunization Practices is stocked with actual experts who can give us good advice. I think the CDC is, again, restocked with veterans who understand what vaccines can do for us, and then with that, try and rebuild the vaccine infrastructure and rebuild faith. I think the irony of Robert F. Kennedy Jr. is he keeps saying he wants to rebuild trust when he's doing exactly the opposite.
Dr. Paul Offit, always good to have you on the program. Thank you so much for your time.